This year's theme for World Suicide Prevention Day is creating hope through action. It's important we empower people with confidence to engage with this complex subject and to recognise we all have a responsibility to prevent suicide. This year, we're seeking to create a movement of preventative action and sustained messaging to ultimately prevent suicide. The COVID-19 pandemic has made us all acutely aware of how our mental health needs must be met as well as our physical health needs. The restrictions placed on our daily lives and routines have meant that for many of us, loneliness and feelings of anxiety may occur. I wish to reinforce that there is support and help available to anyone who needs it. No one must feel that there is no other option. Mental health and emotional distress accompanies any emergency situation when so much remains unknown and uncertain. However, this is normal. For many, the impact of COVID-19 has been indirect. Anxiety and fear, social isolation, low mood, loss of income, and staying at home when home for some is not a safe place. People with existing mental health conditions may have become more disconnected from services and their normal sources of support. Information on looking after mental health and the support which is available across Northern Ireland can be found at www.mindyourhead.information. The COVID Wellbeing NI part of the website contains a number of direct actions which can be taken to provide that help and that support. The Mind in Your Head website also contains a directory of services of local community and voluntary groups who are available to help. Suicide deaths are preventable. They are not inevitable. The feelings that drive suicide are often temporary, and with the right help and the right support, people can get through a suicide crisis and can recover. In Northern Ireland, there are a complex mix of factors which require a society-led response. This includes better mental health awareness and protecting and enhancing personal mental health and well-being. The Protect Life 2 strategy ensures a cross-departmental approach to reducing suicide. The strategy includes a number of programs designed to prevent suicide, including the Towards Zero Suicide initiative, the multi-agency triage team, collaboration between Health and Social Care, PSNI and NIAS, and resilience building and suicide prevention training. Protect Life 2 also ensures suicide prevention services and support are delivered appropriately in deprived areas where suicide and self-harm rates we know are highest. For those in need, Lifeline provides a 24/7 crisis response service for people in distress or in despair. Lifeline can be contacted on 0808 808 8000, and Lifeline counsellors are available to listen and help in confidence. If there is an immediate risk, 999 and emergency departments are also available. The Mental Health Support Fund will equip and enable community and voluntary organisations in providing a wide range of support services for people with mental ill health and to help ensure that those who need can continue to access mental health support services in the community. This fund is being administered and managed by the Community Foundation Northern Ireland and will administer grants ranging from £5,000 to £500,000. These funding awards will equip and enable charities to provide a wide range of support services for people with mental ill health throughout Northern Ireland. In order for the Public Health Agency to develop future services to meet identified actions in the Protect Life 2 strategy, it is also important to review current services and, most importantly, to listen to the views of service users, local communities and other organisations delivering those services. A pre-consultation has recently been undertaken to capture those views. Discussion papers will now be developed for both community-based suicide prevention services and also importantly for post-vention services, outlining options for service development. There then will follow a 12-week consultation, full public consultation process on the future service models. Now, there are a number of key actions that we would wish to see being achieved through Protect Life 2. This will include further embedding of the regional mental health collaborative across health and social care trusts, using a towards zero suicide approach to improve patient safety and to reduce levels of suicide amongst those who are known to services. Provision of timely, accessible de-escalation services for those in emotional crisis or despair. Regional rollout of the multi-agency triage team or MAT service, which is another important and key crisis de-escalation service available to those experiencing acute mental health crisis. Now, this service is currently operating in the Belfast and South Eastern Health and Social Care Trust areas. Delivery of a multi-sectoral training framework in suicide prevention for people working in the community is another important element which we will wish to see taken forward. Development and delivery of public education programs to increase awareness of the signs and symptoms of emotional distress and of the appropriate response, to reduce stigma around mental illness and to encourage help-seeking behaviour. Provision of a consistent, compassionate approach to support those bereaved or affected by suicide. The Protect Life 2 strategy highlights that compassion and kindness give us hope for the future. And I would urge you all to treat everyone with empathy and compassion no matter what they are going through. Encourage and support anyone you know who is struggling, and please signpost them to the services which will help. This simple action in itself will create hope for those most in need and will prevent suicide. And remember, the Lifeline helpline on 0808 808 8000 is available at any time of the day or night should you or a friend or a family member need it.